for us to make sure this thing is deficit neutral without tricks. I said I wouldn't sign a bill that didn't meet that criteria. And what I also said in that speech to the joint session was that I'm willing to put in some safeguards where if we don't obtain the savings that have been promised, then we've got to make adjustments in terms of the benefits. Because the goal here is to reduce costs for families, give them more security, but do so in a way that is not adding to our deficit, that in fact over the long term, if we can bend the cost curve, will reduce our deficit. And I promise you, we're already starting to look at the fiscal year 2011 budget. And
the deficit reduction plan, as mentioned in the previous video, is set to cut Medicare and Medicaid by $320 billion. And what exactly is the plan of action? To change how the federal government pays health care providers. This also includes cutting payments to drug companies, as well as dramatically changing how it splits costs with Medicaid. The downfall of this plan: Medicare recipients will have to pay more, and benefits will be cut for those who depend on Medicaid for health care security. Those on home health services will have a $100 copay per treatment by 2017. Now, the positive: we will raise $400 million in 10 years. But what exactly does this plan do for nursing homes?
Hi, my name is Nadia. Today's topic is going to be on the uninsured population and their access to care. Medicare and Medicaid, as we all know, are two federal-funded programs, each with a different purpose. Medicare is for individuals age 65 and older, whereas Medicaid is for the low-income population. Uninsured older adults aged 50 to 65 are more likely than those their age for medical coverage to receive fewer medical services, die at a younger age, and experience health decline. Part of the reason is because people cannot afford to pay the price of coverage. According to the Kaiser Family Foundation, some older adults delay seeking needed care until they reach age 65 to be eligible for Medicare. In 2010 alone, 18.5% of non-elderly lacked insurance coverage. Nearly 70% of uninsured non-elderly live in households with an annual income below 200% of the federal poverty level. In 2014, millions of Americans will be eligible for medical coverage due to the Affordable Care Act. What does this mean to everyone? Well, insurance companies can no longer deny an individual due to pre-existing conditions, and the average senior will save thousands on health care. In a nutshell, obtaining health coverage is an essential part in living a more healthy life. Our health is an important asset to us, and without it, we have limited access to the much-needed services. Thank you, and have a good one.
Hospital readmissions to Medicare patients are a hot topic in today's news. Hospitals are focusing on discharging patients, spending a little more time going over discharge instructions, because as of today, Medicare will start finding hospitals that have too many patients readmitted due to complications. The penalties are part of a broader push under President Barack Obama's healthcare law to improve quality while also trying to save taxpayers' money. About 2/3 of hospitals serving Medicare patients, or some 2,200 facilities, will be hit with penalties averaging around $125,000 per facility this coming year, according to government estimates. Data to assess the penalties have been collected and crunched, and Medicare has shared the results with individual hospitals. Medicare plans to post details online later in October, and people can look up how their community hospital ranked in the agency's Hospital Compare website. For the first year, the penalty is capped at 1% of a hospital's Medicare payments. The overwhelming majority of penalized facilities will pay less. Also, for now, hospitals are only being measured on 3 medical conditions: heart attack, heart failure, and pneumonia. Under the healthcare law, the penalties will gradually rise until 3% of Medicare payments to the hospital are at risk. Medicare is considering holding hospitals accountable on 4 more measures. These are joint replacements, stenting, heart bypass, and treatment of stroke. Medication mix-ups also account for a large share of the problems. Many Medicare beneficiaries are coping with multiple chronic conditions, and it's not unusual for their medications to be changed in the hospital. But their doctors outside sometimes don't get the word. Other times, the patients themselves don't understand there's even a change. Another big issue is making sure patients go to their required follow-up appointments. The policy also includes rewarding hospitals for quality results and encouraging hospitals, nursing homes, and medical practice groups to join in accountable care organizations. Many hospitals have created programs to address hospital readmission rates with regards to Medicare patients. The top 3 tactics they employ to reduce hospital readmissions is case management at 66%, care transitions management at 62.3%, telephonic monitoring post-discharge at 58%. Thank you.